From all of us at Nunley, Freeman & Owens, we want to personally thank you for trusting us with your dental care or the care of your loved one. We are dedicated to the very highest standards in treatment and want to be personally invested in our patients' wellness and rapid and complete recovery. We are frequently asked many questions about post-op procedures following surgical treatments, such as extraction of teeth or treatment of cavitations. We wanted to give you some detailed guidance for immediately after surgery and in the days to follow. You will receive a post-op bag that includes written instructions, but here are some of the frequently asked questions we receive. Should you expect bleeding after the procedure? Because we use PRF, or platelet-rich fibrin, in each of the surgical sites, post-op bleeding is minimized greatly. You may have a slight bit of oozing, which, when mixed with saliva, may seem like a significant amount, but in fact it is not. If you do have some oozing, you can take a piece of the gauze that is provided in your bag, moisten it, fold it, and place it over the site with some gentle pressure for a few minutes. If it continues, you can also use the tea bag that is provided. Moisten that and place it over the site with gentle pressure to take advantage of the tannic acid that will reduce the bleeding. If you're still concerned with the oozing, feel free to contact your doctor or the office for further guidance. How much swelling should you expect? Some swelling following operative procedures is normal. However, our protocols, such as vitamin C and acupressure before and after, along with sedation and our surgical techniques, minimize and can many times eliminate swelling. However, if we think it's necessary, you will be provided ice packs to use on your face over the surgical site. The best way to do that is 20 minutes on, 20 minutes off. 2 to 3 days following your surgery, you are also able to incorporate some moist heat in the same cycle of 20 minutes on, 20 minutes off, should you need it. How soon can you brush or rinse your mouth after a procedure? Good oral hygiene is essential for healing. And while we would prefer that you not rinse your mouth or brush your teeth too vigorously the day or evening of your procedure, the next morning you are welcome to rinse your mouth gently, and you may also use the soft post-op toothbrush provided in your bag. You will want to brush gently in all areas, but avoid the surgical sites. You may also, in the coming days, utilize a small Q-tip that is moistened in order to clean around the surgical sites and/or the teeth adjacent to it. You will want to avoid using a water pick for the first 10 to 12 days after the procedure, and you will also want to avoid using an electric toothbrush for the first 3 to 4 days after the procedure. If you had sutures placed in any of your surgical sites, they will dissolve on their own in the first 3 to 5 days. How active can you be after oral surgery? While we want you to rest and take advantage of allowing your body to heal, it is also allowable for you to return to normal or fairly normal function within a day or two of the procedure, based on your particular treatment. For most patients, they can go back to regular activity within the first few days. Walking or light activity is fine. However, we ask that you avoid cardio exercise or any activity that raises the heart rate for the first 4 or 5 days. We definitely recommend not smoking. But if you need to, we prefer that you avoid smoking for the first 24 to 48 hours, as that will delay wound healing and lead to dry socket if a tooth has been removed. Will you have pain or need a prescription after your procedure? Some soreness and discomfort is completely normal. Most commonly, we recommend a combination of ibuprofen and Tylenol taken together, as that is more effective and has fewer side effects than prescription pain medication. Your post-op bag will contain written instructions as to the dosage of these medications, and you will also be advised as to what time to take these following your procedure. You may also take any homeopathic anti-inflammatories that have worked well for you in the past. A headache or slightly elevated temperature is not common, but can certainly happen following a surgical procedure. If you are given any appliances to replace teeth, you will be given specific instructions on the care and use of those. Most patients will have a follow-up visit the day after their procedure. This allows time for the doctor to check the surgical sites, make any adjustments needed to the bite, and adjust any appliances that may have been delivered, as well as go over the treatment. Thank you for entrusting us with your care. If you have any other questions, feel free to reach out to our office.